Good day everyone, I'm Dr. Judith Sugay and join me as I discuss the cardiovascular disorders, particularly the structural, infectious, and inflammatory cardiac disorders. For the learning outcomes, at the end of this discussion, the students will be able to explain the pathophysiology of the following cardiac disorders such as structural, infectious, and inflammatory or inflammation. So, be able as well to identify the causes of these diseases, enumerate its signs and symptoms, explain the nursing management and care of these diseases. So, let's start with the valvular function. So, the valves of the heart control the blood flow through the heart into the pulmonary artery and aorta by opening and closing in response to blood pressure changes during the cardiac cycle, such as systole or heart contraction and diastole or the relaxation of the heart. In addition to that, tricuspid valve, which is located between the right atrium and the right ventricle, okay, and there's also pulmonary valve, there's also mitral valve, okay, and aortic valve. So, what are the functions of the heart valves? So, as the heart muscle contracts and relaxes, the valves open and close, letting blood flow into the ventricles and out to the body at alternate times. So, we have the left and right atrium contract once they are filled with blood. This will now push open the mitral and tricuspid valves. So with that, blood is then pumped into the ventricles, okay, and then the left and right ventricles relax. Then the aortic and pulmonic valves close. This will prevent backward blood flow into the heart. Okay, going back, the mitral and tricuspid valves are then open to allow forward blood flow within the heart to fill the ventricles again. So, to continue, the left and right ventricles contract, and then this will close the mitral and tricuspid valves. Then, with that, this will prevent back blood flow. At the same time, the aortic and pulmonic valves open to let the blood be pumped out of the heart. Okay? So, let's find out more about the back blood flow and the narrowing of the valves. Okay, so here in the illustration, you can see here regurgitation compared to a normal valve. Okay, regurgitation, it is the condition when the valve or valves do not close completely. So this will now cause blood to flow backward, just like what you can see here. Okay, so this one, okay. This will now reduce the supposedly forward blood flow and can lead to volume overload in the heart. Okay, so that is called, again, that refers to regurgitation. Stenosis, on the other hand, it's a condition when the valve or valve's opening becomes narrowed. Okay, so you can see here the narrow area. Okay, and this is supposedly the blood that must enter or must pass through that opening. So having a narrowed valve opening, it will now limit the flow of blood out of the ventricles or atria. Now, what will now happen because of that limitation? The heart is now forced to pump blood with increased force so that the blood again can move through, okay, even if the valve has narrowed opening. Okay, so having said that one, the heart valves now can again can either be developing both regurgitation and stenosis at the same time. So also more than one heart valve can be affected at the same time. So again, when the heart valve fails to open and close properly, the effects can be serious. So, Here are the causes of heart valve damage. Okay, so we have coronary artery and artery disease or CAD and heart attack or myocardial infarction. There could probably be a heart valve infection. It probably could be because it's congenital, and then also because of syphilis. And then there's also change in the valve structure due to aging. So one condition is the myxomatous degeneration, so which refers to an inherited connective tissue disorder that weakens the heart valve tissue. So how can you see this one, or how do you observe for this one? These are actually common, okay, common symptoms of heart valve disease, though there are some later that we'll discuss per valve, okay. So basically what you can see, again, patients demonstrate chest pain, palpitations because of irregular heartbeats, and then fatigue, dizziness. In terms of blood pressure, it either could be low or high depending on the valve that's present or affected, shortness of breathing, and then there's also abdominal pain due to enlarged liver, and then leg swelling. So that's edema. So let's see. Okay, so common heart valve disease. Okay, this is one again of common heart valve disease. Then we have mitral regurgitation. So one of the causes of mitral regurgitation that I cited here is the shortened mitral valve leaflet. So here a mitral valve leaflet may shorten or tear. And then what will now happen is that the papillary muscles may be unable to contract because of ischemia, because again there is backward blood flow. In this disorder, each beat of the left ventricle pushes the blood backward into the left atrium. So it will add fluid from the lungs. Okay, the excess blood now, what will happen to the excess blood? Okay, the excess blood causes the left atrium to stretch. If it's stretched, it will eventually get thickened, or there will be hypertrophy. It will be dilated. Then over time, this can result to lung congestion because of the fluid overload. Okay, and which can cause ventricular hypertrophy, okay, dilated ventricles, and systolic heart failure develops. So basically, chronic mitral regurgitation is asymptomatic. Okay, so here are the signs and symptoms of mitral valve stenosis. So with this valve disease, the mitral valve, again, as we've mentioned, the mitral valve opening is narrowed. It is often caused by past history of rheumatic fever. Okay, so this one having a narrowed valve opening, then it could be due to past history of rheumatic fever, and it will increase the resistance to blood flow from the left atrium to the left ventricle. So the heart rate will increase, cardiac output will decrease, and there be increased in pulmonary pressure. So what can you observe among patients with mitral valve stenosis? They have dyspnea on exertion, okay, and then they have progressive fatigue. They actually have decreased tolerance to do some exercises. And then in terms of cough, they have dry cough. There's also wheezing, and then it is because of the enlarged atrium, okay, which may create pressure on the left bronchial tree. Remember, it is because of the narrowed opening of the mitral valve. So next, okay, aortic valve stenosis. So this valve occurs mainly in elderly. So it causes the aortic valve opening, okay, to narrow. So if that happens, again, there will be resistance to blood flow from the left ventricle to the aorta. Okay, and then so this is an illustration of a narrowed or a stenotic aortic valve. Okay, so this one, it's smaller. What are the signs and symptoms? Okay, so there's also, again, dyspnea on exertion caused by increased in pulmonary venous pressure due to dilating the left ventricle. There is also reduced blood flow to the brain, and that's the reason why the patient experiences dizziness, syncope, okay, and then angina pectoris, because of limited blood flow into the coronary arteries. Okay, the blood pressure is normal but usually low. Right, so let's move on to the next, which is the pulmonary stenosis. So with this disease, the pulmonary valve again does not open sufficiently. So this will force the right ventricle to pump harder, and with that effort, it will now get enlarged. Okay, so this usually is a congenital condition. Let's now move on to some diagnostic findings. Okay, we have the echocardiography, so to diagnose and quantify the severity. So also ECG to determine if there's any if the cause of the mitral stenosis is severe, that it affects the heart conduction, okay, or that it could bring arrhythmia. How about cardiac catheterization? So this will help in identifying or determining the severity of mitral stenosis. Just in case there's a need for repair, then it can be done through this one. So what are the treatments for valve disorder? Okay, in terms of medicine, so medicines are not cure for this disease, but they can relieve symptoms. So this includes beta blockers, digoxin, calcium channel blockers. They can reduce the symptoms of the disease by controlling the heart rate, okay, making it into a normal range or within normal range. And then again, this will help prevent abnormal heart rhythms or arrhythmia. So we also have medications that control the blood pressure. We have diuretics as well to remove excess water from the body. Of course, if that happens, you expect that the patient will have increased in urine output. We also have vasodilators. This will help the blood vessels relax. Okay, remember a while ago, we keep on mentioning that there is compensation, extra effort, okay, of the ventricles as they pump blood because of the narrowing, either narrowing or the regurgitation. So this will decrease the force, okay, that the heart keeps on working. There's also surgery. So we have the heart valve repair. So we call that the remodeling abnormal valve tissue. It could also be replaced. So it could be by biologic or mechanical. So biologic valves are animal valves and donated human aortic valves. Mechanical valves, with the term mechanical, they are artificial, okay? They consist of metal, plastics, or any other artificial materials. Okay, moving on. Let's now discuss here the infectious diseases of the heart. We have endocarditis, so there is infection, okay, in the inner lining of the endocardium. So inner endothelial, okay, so that's in the endocardium. And then myocardium, this affects now the muscle layer of the heart. Okay, and then pericarditis, we refer to the outer sac, okay, so here. So that's the pericardium, and pericarditis is the term that we use if there is infection. So, what is endocarditis? As we have mentioned, the infection is in the lining of the heart valve. So, it's also called bacterial endocarditis, infective endocarditis. So, actually, this is a rare disease but has high mortality rate, approximately 14 to 22%. Usually develops among older adults and caused by staphylococcus. So, what are its signs and symptoms? So, there's extra heart sound, heart murmur. You can see the skin turn pale, and then there's either fever or chills or night sweats, and then muscle or joint pain, nausea or decreased appetite. There's also a feeling of being full, okay, in the upper left part of the abdomen. Because of this, because of those that we've mentioned, then there is unintentional weight loss. Swollen feet, legs, or abdomen is also observed, and there's cough or shortness of breathing. Who are the people at risk of this disease? So, those with congenital heart disease. Those who had history or past health history of bacterial endocarditis, and who had injecting illicit intravenous drugs with a needle which is contaminated with bacteria or fungi, okay, scarring caused by heart valve damage, okay, which then allows bacteria or germs to grow. Also tissue damage from having endocarditis, as we have mentioned a while ago, heart defect or congenital heart disease, and having an artificial valve replacement. So, for the diagnostic findings, your doctor, if the doctor suspects that you have endocarditis, then he or she will order a blood culture. Okay, so to be able to confirm the type of bacteria, fungi, or any microorganisms that's causing the infection. So, next, there is also echocardiography, which will now demonstrate, okay, either a mass or it can see the valve, okay, identify any absence or regurgitation. And then next, there is the TEE, or the esophageal echocardiogram. So this will provide additional data to assess the perivalvular complications. So it's through the esophagus. So chest X-ray, just like been mentioned a while ago, this is also done again to check what's causing the lung problems. Is there already a collapsed lungs? Are there fluid? Is there fluid accumulation already in the lungs? Okay. So, basically, again, since there is infection, then there is antibiotic therapy, which usually should be given intravenously for 2 to 6 weeks. The type of antibiotics depend on the result of the blood culture test. Okay, depending on the type of bacteria. Is it a bacteria, fungi, or any other pathogens? Okay, we have parenteral therapy. So this is given in doses that produce high serum concentration for eradication of dormant bacteria within the dense vegetation. So when you say dense vegetation, that's where the bacteria or the causative agent resides and multiply, grow. Okay. So, in terms of surgical management, there is a valve repair and replacement. There can also be debridement. Here, they are going to debride. They are going to debride this one. Okay, that vegetation. They can also close the fistula. As nurses, what do we do? Okay, so we monitor the patient's temperature. So we give medications accordingly. Again, check the doctor's order as to the frequency of medications. And then let's practice good infection control, hand washing, use of PPE if necessary as well. And then assess the heart sounds for any heart murmur. What else? Assess the wounds, if for example post-surgery. Okay, check if it is red. What's the characteristics of the drainage? You have to describe that one. Is there any swelling? And then also check other signs of infection. And then whenever you administer the antibiotics, make sure that you supervise and then you document. Okay, and then watch for adverse reaction of the drug. Alright, another infection here is the inflammation of the heart muscle, and we call this myocarditis. Okay, if there is an inflammation of the heart muscle, you can observe, or the patient can have heart dilation, and this can also be evident on the heart wall, thrombi or thrombus in the heart wall. Okay, so usually this myocarditis results from infectious source, either viral, bacterial, fungal, parasitic, metazoal, and the like. Okay, what do we expect from patients having this one? Most of them, okay, manifest what? Flu-like symptoms. They feel like, they're under the weather. They either, they have fever-like symptoms. So they easily get tired. Okay, they also experience palpitations, and there is chest and abdomen discomfort. So this actually symptoms are somewhat the same of the general symptoms that we have mentioned a while ago, right? So the same thing for the diagnostic findings that we have mentioned here. Okay, blood test, chest x-ray, ECG. So for the myocarditis, however, cardiac MRI or biopsy may be done, okay, in some cases, to be able to check really the abscess, okay. So it's going to be for histopathology. So as nurses, what do we do? Okay, let's monitor the vital signs of the patient. So all vital signs, of course, not just the blood pressure and then the pulse rate. Okay, so of course include there the monitoring of fever. Is there still tachycardia? What's your resolution? Any standing order, and so on. For cardiac monitoring, there might be arrhythmia, so always check the condition of the patient. Again, whenever you check the vital signs like the blood pressure, pulse rate, then you can corroborate results, okay? And then refer to the doctor if necessary, like if there's significant findings, okay, or observations that you made, all right? Okay, and we have here pericarditis. Pericarditis, okay, as I have mentioned to you, is again, there is the inflammation of the pericardium. So this is the sac, okay. It can lead to thickened and decreased elasticity of the pericardium. So if there is some restricted, again, or there is less elasticity of this one, this will restrict the heart's ability to fill with the blood, okay. So the ventricles will pump less blood. What will now happen? It will now decrease the cardiac output, and there will be like followed by signs and symptoms of heart failure. Okay, so just like other symptoms a while ago we've mentioned, they have similar. However, for the pericarditis, most of them are asymptomatic, okay? But should there be any signs and symptoms, we have it here. So we have chest pain, pain beneath the clavicle, in the neck, or in the left trapezius or the scapular region. So scratchy friction rub that you can hear, okay? So what else? Mild fever. There is infection because of the again, you can check on the WBC, white blood cell count, it's increased. and then there could be anemia, difficulty of breathing, and then the elevated CRP again means that there is inflammation. So medical management, yeah, we are just going to treat the cause, okay? So we are after the relief of symptoms. So analgesic medications, non-steroidal, we have the non-steroidal anti-inflammatory. This is medications, okay? So for pain relief, and then we have a procedure that you can again remove the pericardial fluid, so that is called the pericardiocentesis. So having this done, okay, having this done will aid in the identification of the cause of pericarditis. So a while ago, based also in the management, just in the previous slide, again, relief of pain. So for the nursing diagnosis, there is acute pain related to inflammation of the pericardium, having a major goal of again having the patients feel relieved of pain and other complications. Now, what can the nurse do? So, the nurse can assist the patient with positioning, so to prevent dyspnea, encourage gradual increase of activity if and only the patient feels better. And then activity restrictions, again, you do not force the patient to be active or get engaged in activity if they have fever, if they have flu-like symptoms, and whenever they are in pain or any discomfort. Of course, we look forward to positive outcomes such as having freedom from pain, and that later on the patient will be able to manage self-care. Alright, so here are the references that I have used, and again, I would like to thank you for listening. So should you have any questions, any concerns, please do let me know. Let's have more thorough discussion if again there's any clarification in okay, in our class. All right, so thank you, and take care everyone.